To a recent National Institute of Communicable Diseases report, children are less likely to die from COVID-19. The report states that children make up less than 7% of confirmed COVID-19 cases within the country, and the virus is uncommon in children, including those of school-going age between 5 and 18. But for more on that, joining us now is Pediatrician Andrew Redfern. Andrew, thank you so much for joining us. I mean, I suppose, every parent right now is quite worried about their children, hence we're seeing there no interest, or at least less interest, in taking their kids back to creche because of the fears around COVID-19. But please just educate us here and give us some context as to whether or not indeed children are likely or even less likely to contract COVID-19.
Thanks. Morning. Yes, I think it's great that we've now got some of our own country's data in South Africa with that NICD report. And it very much reflects what the international experience has been and what we have been basing our decisions on and our guidance on as pediatricians. So we're following suit with the rest of the world. What started in China and what's been seen in Europe and the States is that fortunately, as pediatricians and for our children's sake, we can say that we are following the same trend where they do seem to get the disease less severely than adults. A lot of children, up to 20 to 30% of children, are even asymptomatic, and they are very unlikely to die from severe pneumonia like we see, unfortunately, with so many deaths worldwide in the adult population.
So the stats show that, children are less likely to contract COVID-19, but also should they do, they would likely suffer milder symptoms than adults. What informs this? What is it about the immune system or the antibodies or their cells that informs this?
So we're not entirely sure, but it does seem like they have a lower viral load. So in other words, they get less of the virus on board, and therefore their symptoms are less. The reasons for that we're not too sure of. We're just grateful for it.
Right. Andrew, I just want to ask then, could this possibly, cause a false sense of security? Because even though, children are less likely to contract COVID or even show less, rather milder symptoms compared to adults, what about then the adults with which the children get in contact with? Doesn't that then put the adults at risk?
Yes, that's obviously a big concern of everyone in terms of children going back to school. And particularly if they've got elderly household members or adult members with comorbidities. There is growing evidence that children are less likely to transmit it. That evidence largely relates to under 12s or under 10s. So, the same may not hold true for teenagers, for example, or high school students. But this worldwide has been a disease that occurs in a household cluster. So in terms of children bringing it into the household, particularly young children under the age of 12, that seems quite unlikely. The recent sort of summary evidence from over 7,000 cases worldwide suggested that 75% of the time children had got it in a household. Where I work at Tygerberg in Cape Town, we recently have been looking at our first 100 or so cases, and more than 90% of the children that tested positive did so in the context of an adult contact. So in other words, children, particularly young children, seem less likely to bring it into the household. Yeah. Having said that, I can't say that with the same confidence for high school children. And obviously, that's not saying that they don't transmit it at all. It's just saying that they seem less likely to based on the international experience. But that doesn't mean that they can't bring it back to a family member and give them the disease.
And just before I let you go then, we've been just generally talking about, healthy children here, assuming that the children are 100% healthy. So about those children who perhaps have underlying medical conditions, what about them?
It's a great question. The vast majority of children with a comorbidity as such should be absolutely fine. The children that I think we would be concerned about would be children where they're on drugs like chemotherapy for cancer treatment, where that suppresses their immune system, or they have an underlying problem with their immune system where they might not fight infections normally, because children with a normal immune system are going to fight this infection just fine. Children with, for example, a very common condition like asthma, most children with mild to moderate asthma will be absolutely fine. They might get a bit of a mild asthma attack, but they're going to be absolutely fine. Children with a very severe asthma that's had a life-threatening asthma episode before, maybe we need to be more concerned about them. But the vast majority of children with chronic conditions will be absolutely fine.
All right, that's where we'll leave it. Thank you so much for just highlighting some of those important points. That was Andrew Redfern, pediatrician working there at Tygerberg Hospital.